Sure.
Use the microphone, Steph, just because some people get background noise.
Yeah, that's Kira. Okay, can you hear me? Okay. And tell me if I'm belting now, and you're drowned out by my voice. So I will say a few words about the video, because I think why I was asked here today was because we had created this video and you wanted to hear some stories about how we had used it to frame the issues and perhaps how it had been effective at framing the issues in some cases. So I'll share a couple of examples. And I know that earlier today, Barb, you were speaking about the municipal policy scan, and one of the things that you've done with that after that was completed was that you, of course, had taken it out to the various municipalities. You presented your results. Now, what Barb didn't say was that as part of that presentation of the results, in most cases, you always showed this video, so that it is intended to do exactly what the title is, to start the conversation. And I hope in those cases, as one of the examples, that it did that it was used to start councillors and to start municipalities thinking about what are the broader conditions that are really impacting health, followed by a presentation of here's what we learned about your particular communities as it relates to policies that support health, that led into a discussion about what are some of the ways that we can now work together to build some of those policies as one possible example. The example that I'm going to touch on is a very specific example of use of this video and how we've used it in connection to the promotion of equity-focused health impact assessment, which we spoke about earlier. We have, in part thanks to Dave Courtemanche when he was mayor for our city of Greater Sudbury, a Healthy Communities initiative that's rooted in our municipality. It's led by our municipality. It is founded on pillars of economic health, environmental health and well-being, social health and well-being, and of course, active healthy lifestyles, healthy lifestyle components. We have associated with that initiative a Healthy Communities Cabinet, which is made up of various leaders from across sectors who meet, who discuss, who plan, to really work towards initiatives that foster healthy communities broadly, looking at the broad range of factors that contribute to health. So we were lucky with the city of Greater Sudbury that we had this forum, this venue, to think about how we might use the video in support of furthering healthy public policy. So we were invited to present to that cabinet, and we didn't just take the video. I think this is really important. We didn't just take the video and show a video and then have a discussion. There were several key factors in place which led to some effective change. The first is what I call the story, and the story was the video. So we were able to show something, we were able to talk about something that was a more tangible example. It was really a story about, we know it to be a health inequity, the story of Nadia, and how conditions impact our health. And that was, I think, engaging for people to see. We then followed it up immediately with some real hard data about the health of our communities. And in our case, it was data about health inequities that exist in our community. We've done some recent analyses using a deprivation index to look at where geographically within our city there were certain health inequities as well as others. And we showed some really startling things in that data related to infant mortality rates, related to teenage pregnancies and births, obesity rates, and we were able to present to the cabinet some statistics about their own community and about some of the challenges that they were facing, specifically as it related to health inequities. We didn't leave it at that though, because we told a story, we presented some data, we told them the problem, and we now wanted to provide them with a tangible solution. And for us, that was equity-focused health impact assessment. So I followed up with a presentation about health impact assessment, which is looking at policies from across sectors, from across disciplines, from across areas within our community, and saying what are the impacts on a broad range of factors that we know are health. What are the impacts on economic development? What are the impacts on social well-being, transportation, etc.? We presented the tool, we presented the process, the variety of tools that could be used, the way that public health could support sectors, because we're talking to a cabinet that was leaders from education, leaders from community health centers, Aboriginal, First Nations communities, etc., about how equity-focused health impact assessment could be used by them in their sector to look at their policies that shape health. And then we put it out to them. We said, we want to support you to do a health equity impact assessment. So we're looking for volunteers. What kind of proposals have you got on the books right now coming up that we can work with you to do HIA? And we got more volunteers than we had capacities to support, which was startling for me. That when people heard the story of inequity, when they saw the data about inequities, and they had a tool that they could actually use to address the problem, that we got hands going up. And I was really expecting to have to call every one of them after the meeting and say, hey, we asked for volunteers, and how about putting a policy forward and we can work with you. So that wasn't the case, and we ended up doing two community-based impact assessments, one with what was called the Community Door Working Group. It was led by the United Way, looking at a proposal for a shared space for human service agencies. So they were proposing this new model of human service provision, and they wanted to do an equity-focused health impact assessment on that. So we've worked with them to complete that and put forward some tangible recommendations. The other one is with the Art Gallery of Sudbury, so not your usual partner, also around a purpose-built gallery space, so a new facility. But the story doesn't really stop there. When it comes to municipalities, as a result of that work, our municipalities started getting a bit of pressure from the cabinet members to fully endorse the use of equity-focused health impact assessment as part of all of the municipalities' large-scale projects. So in the most recent strategic plan from our municipality, the application of equity-focused health impact assessment is a strategic priority within that plan, and we're currently working with them to figure out the details of how that will be completed. So I have been working directly with the city now to figure out what kinds of tools can they use, what are the processes that they can actually realistically put in place to assess their upcoming policies and proposals, large-scale policies and proposals. And how are those recommendations that come out then proposed to council? So there are a few steps along that process that obviously details need to be worked out, but having it in there in the municipal strategic plan has been a huge achievement for us, because it gives us something to work with as we now advocate for healthy public policies across the board.
All right, well, that's exciting. Sounds like quite an adventure. You may have questions. I encourage you to write them down. We're going to hear from everyone first, and then we'll open it up. Thanks, Stephanie. So, David, do you have a video that you'd like to share as well?
Yeah, sure.
Later.
Just give me a moment though before we tee it up. Thanks. Hi.